Hello everyone. My name is Dr Prashant Jawale and I am the lead clinician and consultant at DocOnline. Today on World AIDS Day, we are going to talk about AIDS, its transmission and ways to prevent it. 1st December is observed as World AIDS Day with a focus on a specific theme every year. The year 2022 is tagged under the theme Equalize, a call to action that inspires us to work in solidarity and address inequalities to end AIDS. As per WHO, in the year 2021, 38.4 million people worldwide were living with HIV, with 2.5 million new cases and 650,000 deaths attributed to HIV related illnesses. Did you know India has the third largest number of HIV infected people worldwide? With 2.1 million people living with HIV, the epidemic in India is largely driven by sexual transmission, accounting for the emergence of 88,000 new cases and 69,000 AIDS related deaths every year. Despite advancements in the management and continuous efforts to increase awareness of HIV, it is still seen as a punishment in many Indian communities. It is worth mentioning that HIV is a viral disease, just like other diseases. It's not a punishment or a curse. So, what is AIDS? AIDS, that is acquired immunodeficiency syndrome, is the last stage of human immunodeficiency virus infection. The virus replicates inside the body and over the time without treatment wears down immunity to such an extent that the body is no longer to able to fight off the infection in the late stages causing AIDS. Who is at the risk for HIV infection? HIV can affect anyone irrespective of sexual orientation, gender, economic status, or religion. Anyone who is sexually active or has multiple sexual partners can get HIV. However, in India, HIV is more common in homosexual men, sex workers, transgenders, people who inject drugs or share needles, and migrant workers or truck drivers who practice unprotected sex. Mode of transmission of HIV. The virus can enter the bloodstream of an uninfected person through contact with an infected person's body fluids like blood, semen, vaginal secretions, anal fluid, breast milk, and exudates from wound or skin. Transmission can be sexual through unprotected sex, maternal from an infected mother to baby during childbirth or breastfeeding, needle or instrument related, that is, sharing contaminated needles, transfusion or transplant related. It is, however, rare now since the screening of blood or organ is done for HIV. Remember, HIV can't survive in the air or water. You cannot get HIV by touching or hugging someone with HIV, sharing a room with, or sharing utensils, toilets, or swimming pools, mosquito or insect bites, sweat, tears, cough, or sneeze of an infected person. Testing for HIV is the only way to know if you are infected. Most people don't show any symptoms or have flu like symptoms like fever, sore throat, fatigue, muscle or joint aches, and headache, which may last for a few days to a few weeks. If the treatment is not taken early, the infection progresses to AIDS, where one is prone to get more and more severe infections owing to a severely damaged immune system. Treatment of HIV. There is no cure for HIV or vaccine to prevent it. However, an antiretroviral treatment, that is ART, started immediately after diagnosis can prevent virus multiplication and ensure a normal lifespan for people with HIV without ever translating into AIDS. HIV transmission can only be prevented by following safe sexual practices, that is, by using condoms. Pre exposure prophylaxis, that is, daily course of antiretroviral drug, that is, ARVs, is recommended for HIV negative people at high risk, like spouse of an HIV positive person or sex workers. Never share needles and avoid drugs. Get a screening test to know your status. HIV positive pregnant mothers can take medicines to reduce the risk of transmission to the baby. ART effectively fights against HIV if started at the early stages. Drugs consumed rightly as advised by healthcare personnel and sticking to the regimen prevent drug resistance and work well. Together, let's spread awareness about AIDS and help in preventing its transmission any further.